Hi everyone, my name is Nusrat and I'm presenting on behalf of Maria Leveridge and myself, Nusrat Kausar, regarding our involvement with the @Diabetes 101 Twitter account during the COVID-19 lockdown. Coronavirus has led to the whole world having to change the way it works, and here in the UK we were no exception. As dietitians in the NHS, we have had to change the way we work with patients, from how we provide and elicit information to how we treat and review patients with diabetes. The great UK lockdown meant lots of people with diabetes were advised to stay at home, to keep safe, and some were even asked to be shielded by their GPs. The government released guidance to help the public understand more about what they needed to do. However, the virus, the changes to lifestyle, work, education, exercise all led to an increase of distress, anxiety and questions from people with diabetes. Additionally, it also increased worries about ending up in hospital or going to hospital, and many more things that I'm sure all of us, even without diabetes, had to worry about. This led to the COVID-19 diabetes heroes being born. The @Diabetes 101 Twitter account was born as a hero saviour for people with diabetes. It all started with Dr. Partha Carr, consultant in diabetes and endocrinology in Portsmouth, and the NHS National Speciality Advisor on Diabetes, who wanted to help provide up-to-date, accurate advice that was from healthcare professionals specialised in diabetes. He invited Amanda Epps and Beth Kelly, co-chairs of DSN Forum, to join him in this mission. Assigned to them was the task to set up the account and recruit a team of heroes covering the array of professions in diabetes with expert knowledge and a strong Twitter presence. So what is the @Diabetes 101? The @Diabetes 101 is a Twitter account managed by a group of diabetes healthcare professionals to help provide people with diabetes a daily source of security and reassurance in a frightening and worrying time. The team, made up of 21 diabetes specialists, includes consultants, adult and paediatric diabetes nurses, adult and paediatric dietitians, pharmacists, a GP, a research doctor and a psychologist. The @Diabetes 101 account opened its online doors on the 23rd of March and has gained over 4,000 followers to date. It has reached over 4 million impressions to date and has provided direct advice to hundreds of people since its launch. As a team, we have been answering over 100 queries per day. The group does not offer clinical advice but does give generic advice and signposts people to relevant information and reassures people living with diabetes that they are still supported. During the first 4 weeks of the @Diabetes 101 account, the group offered a timetabled structure consisting of a morning and evening shift, each manned by 2 members of the team, and more where possible. This structure was a deliberate decision by the team, as advised by clinical psychologist Dr. Rose Stewart and Diabetes UK clinical champion. When the lockdown hit, many people lost their normal routine, which can contribute to a sense of being in freefall. Having a predictable structure in our content allowed us to help contribute to a sense of normality, and it was comforting for people to know that others in the community were doing the same activities together. Fun activities were also run most days alongside, including cooking, talent spots, afternoon tea, a pet gallery, quizzes, picnics and party nights. As well as boosting morale and raising awareness, the group also ran education sessions. Various educational tweetorials were run on a Tuesday and Thursday evenings. They were run in an innovative manner to ensure engagement and interaction. The slides were scheduled every 5 minutes and questions were answered as the session went on. Alongside this, Twitter polls were run to test knowledge, and there were fun, interesting Canva posts to support the slides. The tweetorials included diabetes and eyes, questionnaire with Partha, statins and blood pressure medicines, getting the most from virtual consultants, foot health and diabetes, relaxation, sports and exercise and diabetes, practical approach to management of CGM and flash glucose monitoring systems for young people with diabetes, medications for the management of type 2 diabetes, diabetic kidney disease and compassion. Additionally, polls and quizzes were run, and there have been 3 The Big Bank Holiday quiz organised and tweeted by the team, including a foodie quiz. There were 30 questions and over 300 votes per question. Maria's foodie quiz had lots of questions that she set alongside some of the team, and these are some of the statistics from the food quiz. As you can see, there has been lots of engagement and lots of impressions. and these were on the day and also since then. More recently, the team responded efficiently to data published by NHS England about diabetes relative risk and COVID-19 deaths. They work round the clock to produce resources to help people understand the numbers and the research behind these. And this FAQ document that was produced with all the answers to the FAQs has been widely shared amongst healthcare professionals. So what did we as diabetes dietitians get involved and do? As dietitians, Maria was involved from the outset of Diabetes 101 and Nusrat joined the team a week or so later. Since Diabetes 101 came into existence, Maria and I have helped man the account nearly daily at the assigned opening times and answered questions on the account. Additionally, we have come up with questions for the quizzes, particularly the foodie quiz. We supported other healthcare professionals in the group answer any questions that were dietetic that came up on the account during any of the tutorials that ran, or otherwise. Alongside PDSN Sam Barnard, I ran a tutorial on sports, exercise and diabetes. This was very intense and myself and Sam answered lots of questions on this topic. Additionally, myself and Maria have possibly read over 100,000 WhatsApp messages behind the scenes to help ensure what you saw at the front of Diabetes 101 ran smoothly. At the time of doing this video, there have been over 4 million impressions on the whole of the Twitter account. These are some examples of slides that myself and Sam designed and wrote around for our tutorial. So what dietetic adaptations did myself and Maria have to do during COVID-19 at work? Prior to COVID-19, I was locuming in specialist diabetes clinics in the community. Up until the lockdown, I was working as usual. However, after the lockdown, redeployment of staff and diabetes nurses and the changing of services meant I was no longer needed. I was then contacted by my last trust to ask if I would work on critical care during the outbreak. Therefore, for the next 6 weeks, I worked as a locum on critical care wards during COVID-19. Initially helping with rewriting the COVID-19 standard operation procedure for dietitians on ICU and seeing patients in person and remotely from the office where able. The Trust worked really fast to create a paperless patient record card that was specific for remote reviewing and made it possible to see patients remotely on critical care. Outside of ICU, I went on Viva FM leads to talk about COVID-19 and dietary advice. I helped man the Diabetes 101 account as previously discussed. I presented my first virtual presentation to Leeds University nutrition students on training and working on dietetics. I worked with a BDA public health specialist group to launch and create their social media accounts, Instagram, Twitter and Facebook. I worked on launching myself as a freelance dietitian, particularly in sports and diabetes. I also worked on a business project idea, building up a catalogue of videos for patients to have first-line dietary advice, and created and launched and helped run their social media for this. That's Nutribytes. Had various video and virtual meetings, as I'm sure we all did throughout COVID. I also fasted during Ramadan and had a socially distanced Eid. The dietetic adaptations during COVID-19 at work for Maria were that as a specialist paediatric diabetes dietitian during the COVID-19 crisis, she converted a lot of her contact that was clinical, usually face-to-face, to various online methods through email, telephone, text and video consultations, as I'm sure many of us have done throughout the COVID-19 lockdown. She planned to support the pressures on the hospital trust by continuing to work in this format and having a limited face-to-face outpatient service to be able to resume in the future. Prior to COVID-19, Maria was, for 3 years, taken part in the on-call rota for sick children, expanding to weekends in January 2020. Her popular hashtag Cook and Eat Exeter and hashtag Tree of Life Exeter sessions are now on pause. However, these may convert to online sessions for the duration of COVID-19 restrictions and social distancing requirements. Outside of work, Maria has been sewing headbands and various other bits to help nurses and staff on the wards with PPE. For people like myself with no ears and a scarf, it's really helpful and it really relieves the pressure for nurses wearing PPE at long periods of time. So that's the team. Please follow them and see what they have been up to and what they are planning to get up to next. There have been 21 fantastic, adaptable and creative diabetes professionals working together to support patients with diabetes in their own time. It has been a fantastic experience and I have learnt so much and really enjoyed being able to help people with diabetes throughout this difficult time. Thank you very much. If you would like any further information about this, please contact us via Twitter.